Tonight we begin with the paralysis in hospitals around the country. And the Bungoma County Referral Hospital has been shut down as the health crisis in public hospitals deepens. Bomet's Referral Hospital, Longisa, has also been vacated by all patients for lack of medical services, following the health workers' strike which entered the third day. And despite agony and suffering being experienced by patients across the country, no attempts are being made by any quarters to engage striking workers to resume services. Let's begin our broadcast tonight with our very own Dorcas Wangira.
The center can no longer hold at the Bungoma County Referral Hospital, even with a few doctors reporting for duty. Without nurses and clinical officers, the healthcare provision has been paralyzed. As such, services at the hospital, both inpatient and outpatient, have been suspended. In the wards, a patient cries out in pain, but no medic is at hand to attend to him. Relatives and other caregivers have been asked to come and pick their ailing patients and look for alternative health care. We find a male patient in a critical condition. His relatives ponder on what to do next. The wards have become a mosaic of empty bed after empty bed. Outside, another male patient with a cast on his left leg is steeped in thought over his fate. A hospital guard motions for him to leave.
Good. We believe that a solution will be found. This is a situation that cannot continue for too long because one life is too many.
The Longisa County Referral Hospital in Bomet looks equally deserted. Empty beds, hemodialysis machines that would otherwise be at peak noise levels are inactive in a silent ward. The pediatric ward is deserted. The benches gather dust. Outside, the nurses and clinical officers march in solidarity. Key demands: a comprehensive medical cover and enhanced risk allowance. Patients, their relatives and their caregivers can only stare, knowing well there will be no treatment at this facility that would on normal days attend to hundreds of patients from Bomet and Narok.
Tunaendelea kwa sababu ya kitu inaitwa promotion, vitu inaitwa redesignation, tunahitaji vitu inaitwa health risk allowance amount of 30,000. Hiyo ndio kitu tunataka.
In Nyeri County, services continue uninterrupted. According to the county government, there has been no disruption of services. Likewise, in Laikipia, patients receive services. Laikipia and Kirinyaga, two counties where doctors are demanding for reinstatement of colleagues fired by the county governments. In Kisumu, where the chief officer for health termed the strike as illegal, the Kenya Union of Clinical Officers chairman and regional representative for Nyanza region has said in a rebuttal statement, and I quote, "Kisumu County government is simply in denial. The claim of illegality of the strike does not invalidate the fact that they discriminated against clinical officer specialists in accelerated promotions while giving all doctors the same." I urge all clinical officers in Kisumu not to listen to this blackmail from the county government and keep away from facilities until our demands are met. We have even submitted to them the names of our colleagues, but they still play their games with us, end of quote. In Nairobi, operations are minimal. The nurses and clinical officers say what urgently needs to be addressed is the issue of promotions, where nurses have remained in the same grade for up to 10 years, and the provision of standard and adequate PPEs.
SRC is now laying. It is laying a trap. It is waiting for any announcement that give nurses this or clinical officers this or health workers this, then they'll sprout and say wage bill. Where is SRC? When we are increasing members of parliament to 650. Where is SRC? When we are increasing, now introducing assistant ministers in this country. Where is SRC? When we are expanding the executive.
There's no healthcare in this country without nurses. They are the backbone. Now that they are not in the hospital, there's no service going on in the hospital.
The demand for healthcare does not cease even in the event of a strike. For an important facility such as this one, which serves the population of Kibera and its environs, between 8 a.m. and 1 p.m. would be the busiest times. But the situation now is different. Fewer patients have been coming to seek treatment since the strike was made public. The question is, how long will this situation persist? Dorcas Wangira, Citizen TV, Nairobi.